Thank you very much. My name is Dr. Simon K. KIMANI. I'm the head of Department, Public Health in Kenya Medical Training College. This department was actually started or initiated in 1947 by a colleague called MFC Gaffney. It was initially started in Kabete, the current Kabete area, but moved later on to Kenyatta, where we are. The campus is located currently. Actually, the course involved training of public health inspectors then under the British government, and it has gone through many changes over the years to different names up to what we are using today. We call ourselves public health officers. We also have the public health technicians and public health technologists, depending on the exit level. We have the certificate exit level, we have the diploma exit level, and then we have the degree exit level. Initially the course was in East Africa, and this involved Uganda, Tanzania, and Kenya, and people are trained, and they used to rotate between Kenya, Uganda, and Tanzania, and covering several modules in those particular areas. At times, this course is also called environmental health, and in other jurisdictions in the world, we call these officers environmental health officers. So they are the same, whether you are a public health officer or environmental officer. Normally, these are the same officers that we are referring to. In 1978, His Excellency the President Jomo Kenyatta gazetted the name public health officer in Kenya, and therefore we changed from public health inspectors to public health officers in our country. This course was later offered by the University of Nairobi in collaboration with the College of Health Professionals, the current Kenya Medical Training College today. There are several programs under this department. The first one is Certificate in Environmental Health Sciences or Certificate in Public Health. These certificates last for 2 years. It is offered in a number of our campuses in KMTC. After 2 years, then the student is awarded a certificate in environmental health or a certificate in public health. There is also another program, the 3-year program. This is the diploma in public health. This is a 3-year program which a student takes for 3 years. Then we also have another program called Upgrading Diploma Program. This Upgrading Diploma Program takes 2 years. These are students or graduates who had graduated in KMTC with 2 years program, worked for 1 or 2 years, and then comes back to KMTC to upgrade into a diploma program. Then from there we have the higher diploma programs. These are post-basic diploma programs which include epidemiology, which lasts for 1 year, solid waste management, which also lasts for 1 year, food science and inspection, it also lasts for 1 year, and we have the occupational health and safety program that also lasts for 1 year. These courses or these post-basic diploma programs are for students who have graduated from KMTC, have served in the field for 2 years, and then they come back to specialize in these particular areas. There are key modules that normally we cover in each of these programs. Fortunately for all the basic programs, whether it's certificate, whether it's diploma, whether it's upgrading diploma, they cover almost similar modules. The variance is the depth of the program and the year or the time we take to undertake the program. For certificate diploma and upgrading diploma, then we have specific modules. For example, you have the built environment. The built environment module, this involves studying of building construction in much depth, depending on your area or in your course that you are undertaking. Then, for example, you have plan approvals for any building that comes up in the Republic of Kenya. the officers are involved in approving the plans at all levels of development. So if you go to the planning department, you'll find the public health officers there, and they are involved there because of planning approval for public health purposes. At the same time, within the built environment, they also do what we call certificate of occupation. Before any building is occupied, they are supposed to issue a certificate of occupation, and therefore they must be involved at each and every level. The difference between the trainings, the certificate, is that the certificate holders will mostly go to PEG. For example, the small structures or simple structures in rural areas, in the rural setup, or the other programs like the diploma and above will go to oversee the construction of big constructions, bigger buildings, not just approving, but making sure that it comes up as they had decided. Within the building environment also, the students are supposed to undertake technical drawing. They're supposed to know how to draw these plans, to interpret these plans, even as they go to implement them on the ground from the construction all the way up. Then we also have something in that area that we call rural and urban planning. Most of our officers are involved in the planning of towns, planning of centers, whether it's any type of settlement. And therefore, they are supposed to learn this in school, and with this we teach it at the built environment area. Within the public health engineer, the other module is public health engineering. This is also a very key module that we undertake in our areas. This area involves, for example, the drainage area, the water supplies. This is the water we consume. They must undertake this in details. We also have the liquid waste management. How do you handle the wastes that we generate after using the water in our towns? Then they are supposed to be involved in the management of this, as well as the solid waste management. After the people use all the garbage, where do you take it? How do you treat it? How do you manage it? Our officers also do this. And as I said earlier, you could have had the higher diploma programs being mentioned. Some of these are the specialties our students, after doing the basic training, they come and continue at a higher level. The other module is community health. This is a very important module. This is where the students are taken through epidemiology, disease management, causes, and controls. Then we also have the occupational health and safety in this area. The students are taken through the industrial attachments, industrial observations. What are you supposed to look for? How are you supposed to approve industries? What safety and measures are supposed to be taken in each and every factory? What are the seating, for example, arrangements? How are the seats supposed to look like? What is the spacing of workstations in a industry or in an office? This is the area where students are taken through. Then we also have the communicable diseases and also non-communicable diseases in the communities. Students are taken through that as well as pest control. They are also taken through the low-dense vermin and pest control for our community members. Then we also have the port health also falling under this community health module. These are officers that are based in the airports and the ports of entry to undertake public health measures to ensure the people coming from outside this country or the food entering this country is safe for use in Kenya, as well as the making sure that diseases do not move from one country to the other, or we do not export to other countries as well. The other module is food science and inspection. This is a very important module as well for all the cadres, for all the exit cadres, whether certificate, diploma, and higher diploma. In this area, we look at the foods, the food that we use, whether the plant, whether they are originating from animals, how are they supposed then to be consumed. So we take students through the foods that we use. We take students through the nutritional values, what they are supposed to advise. We also undertake meat inspection in this area. I know meat inspection is undertaken by the vet doctors from the slaughterhouses, but normally we take our students through from slaughterhouses all the way to the butcheries and to the table of or where the people eat, or where the food is served. And therefore, once the vet doctors finish with the inspection of food, we are supposed to monitor the movement of that meat from the slaughterhouse all the way to the where the food is being sold, or where the meat is being sold. May it be a slaughterhouse, or may it be a butchery, or a food establishment, and how it is served therein. Then after that, we also have property inspection. We look at the food hygiene. Where are they displaying the food? What is the state of that premises? We also teach this, and the students are supposed to be taken through so that they know how to inspect. What are they supposed to do in terms of recommendations, and what is supposed to be observed by the respective establishment owners in our country. The other module is the general public health. In the general public health here, we look at the practice. We look at the public health practice in the country, and we take students through, for example, the public health law. Within the public health law, we are looking at the various aspects of the human existence. We look at whether it's building, whether it's foods, whether it's in any area that will affect public health, whether it is diseases coming from outside the country, whether it is management of emergencies as far as health is concerned. This is taught under the public health law, and therefore we use this. And I think this is where the president recently used to declare the rules of COVID, the protocols, the many areas that you see the country being observed. It was actually developed at the public health laws that allow our country to undertake so many measures to prevent the spread of any disease coming from outside or coming from inside, to ensure the public is not affected at all. We also have the public health practices. Other practices that may relate to public health are also taught in this module. Then we have the attachments, the various industrial attachments. We also look at them here because for our officers right from certificate level, the certificate level officers mostly are attached to the level 1 health facilities. Those are villages and sub-locations or wards. Currently, the diploma program are attached in urban areas and semi-urban areas. And this is where they're supposed to go for their practicals at all times. So this is also important here. And the other thing that is also covered in general public health practice is emergency public health. Sometimes for emergencies that you don't anticipate are also covered in this area, as well as disasters. So for all these basic, those are basic. For post-basic programs, for example, epidemiology, food science and inspection, occupational safety, solid waste management, the modules covered here, they vary. They vary specifically, but mostly we have the standard modules that are covered under this area. For example, statistics, the health service management, and they cover this as a team before they migrate to their individual areas. Organic and inorganic chemistry, for example, public health planning, disease prevention and management. These are some of the key modules that you'll be expected to cover in post-basic program areas. For the modes of study, we have the certificate. It's full-time. I said earlier it's 2 years. Diploma is full-time, which is 3 years. Those are freshers or pre-service students that come directly from secondary schools. Then upgrading program, we have the full-time. It is normally 2 years, as I had mentioned earlier. For the post-basic programs, the solid waste management, we have the full-time and also the part-time. Here, this is where the officers are working, and therefore there are those who opt to do a full-time of 1 year. There are also those who opt to do part-time, and therefore we offer part-time training in this particular area. For epidemiology, we have the full-time, which is also 1 year. We also have evening program. Evening program is where the students come in the evening from 5 to 7 in the evening on working all the days, and the Saturdays from morning to evening. That is 8 to 5 on Saturdays. Then we also have part-time for epidemiology as well, just like the other higher diplomas. where the students can take these modules, move to work, come back, and then take the other modules until they finish. Then we have occupational health and safety program. These are full-time program for 1 year, and we also have a part-time program for this particular program. The other one is a food science and inspection. There's full-time 1 year, and also part-time. We also offer this part-time, where the students can come in, cover 1 or 2 modules, go back, come back. So we have special arrangements with the students. The students comes, expresses themselves, and then we as a providers, we are able to do that and agree on how to offer that program with the students. For the placement areas, these are the practical areas. As I mentioned earlier, we have the government placement sites, whether the national or the county. We also have the non-government organizations where our students are attached for various projects that are being undertaken, for example, UNICEF, GIZ, Kenya Red Cross. We also have the industrial attachment, so there is private on mutual agreements with the officers in the field. And as I said, certificate holders, we attach them mostly in the rural area, rural setup, where the communities are. That's level 1 of our facilities, dispensaries and health centers. Then from there, we have the diploma who move to the wards, the current wards in our country today, and the county level. That's where we place them, and also the national level. We also have the, for example, the national levels like the airports. We also attach our students in the international airports, also in the port of entries in our country, and other special areas. For example, the food establishment, factories processing foods. These are important areas. We take students to those places and they last there for the period. The school fees, these are there. They are normally provided for in our website. If you visit the KMTC website, we have the regular programs going for 80,700 Kenya shillings. A self-sponsored program going for 120,700 Kenya shillings. And of course, within the school fees area, you can also apply for financial aid from Afya Elimu Help Loan. You can apply from the national government, CDF, for support on financial support. And also the county government education funds, among many other sponsors that can sponsor students for school fees to be supported in our institution. What are the roles of you people, the officers, the students that we train as far as the health sector is concerned? And as I alluded in some of my presentation is that, for example, in the built environment, I mentioned about the plan approvals. We have occupation certificates, issuance of occupation certificates for any building to be occupied. It has to have that. And then, of course, implementing building bylaws within that particular area of that particular module. We have within the food safety, within the food inspection module, we have the food safety that with the foods of human consumption, all foods, looking at food establishments, certification of food establishments, are they safe to offer food? So that's the officer's role in that area. Then you, of course, you have this food safety and control. And then implementing also food laws. When you hear the Food, Drugs and Chemical Substance Act, Chapter 254, these are the officers who do that, and they're supposed to oversee that. Within the pollution control, there's drainage inspections. When the officers are approving buildings, they're also supposed to look at the drainage, how would that flow, the waste management, liquid waste management. We look at the air quality. How is the air exchanges within the building? How safe will it be, or will it be a source of disease to many citizens? So before you approve or before you allow, then this is also an area that you look at in the air quality control area. Within the occupational health and safety, we have the industrial inspections, lighting and ventilation inspections. We observe what are the lighting, what are the ventilations, what are the specifics that are required in a building as far as health and safety is concerned. We look at the economics. We look at the sitting, how are the officers supposed to sit, how the placement of the desk versus the seat, and how many hours the officer is going to be exposed, to be in that seat. What are the break times? How are they supposed to break, and what are they supposed to be doing? Stretching, not sitting for 8 hours. So we look at that. So the economic part of management of the workplaces is also important in this particular area, and most of us are supposed to look at that. Then within the community health, we have the disease surveillance. We have the port health services. We have the public health prosecutions within this area. We have the public health promotion and also the pest management. All these are roles that our students are supposed to undertake once they graduate from our institutions in our country or in KMTC, from KMTC. The employment, mostly our graduates are employed by government at the national level and as well as the county level. We also have the non-government organizations in various, many of them in our country who offer employment to our graduates. A number of our students are actually in the non-government organizations as we speak now. Then we also have some of our students, former students in private practice, in public health. Some of them are having pest control management organizations or heading those organizations in private practice. They are doing fumigation and all that in our country. So those are the employment opportunities for our students. In the academic progression, yes, you can actually undertake a certificate from us here in KMTC, and this is the institution that actually is a pioneer of public health training in our country. As I said earlier, we progressed from all the way up to where we are today. And therefore, all the institutions that have initiated this program initiated it or benchmarked with these institutions, if not staff from here going to establish those programs in those areas. And therefore, we remain the pioneer institution as far as public health training is concerned. So you can have a certificate training for 2 years. You can progress to diploma upgrading program after 1 year. Then you can also undertake a Bachelor of Science in Environmental Health or Public Health, and also undertake a master's degree, and then a PhD. So you can start actually from a certificate all the way up to PhD, and that has happened before. You can also start from a diploma. After the diploma, you can do the degree directly, then master's and PhD. You can also start from a certificate. You do a diploma, you do a higher diploma, and do a master's and PhD as well. You can also do a diploma, and then you can end up at the higher national diploma. This is where the main areas that our people are. And I think it's good to tell you, our students, that it is possible. Some of us are graduates of this college. I came here 31 years ago, in 1989. I took a diploma. At least I entered through a diploma program. And currently I hold a PhD in public health. So it's possible to actually move from in the academic progression. We are a testimony of that. And you can be here to grow this institution for us and for Kenya. We have a number of partners that we work with. First of all, we have the government, both at the county and the national level. Then we have the ministries that we work with very closely. This is our mother ministry, which is the Ministry of Health. We also work very closely with the Ministry of Education when it comes to school health. We have the Ministry of Environment. This is where we also work very closely. This is where NEMA and other programs are based. We have the Agriculture Ministry. We have the Livestock Ministry, as I said, the meat inspection and all that. The Agriculture Ministry because of the foods. The Livestock Ministry because of the meat inspection and all that. That's where they are. The Fisheries and the Cooperative Ministry, they are also very important because fish is a part of food that we inspect and allow for consumption in our country. We have also labor and social protection. This is where health and safety docket is based. We also have the Minister of Water, as I said, wholesome water or water supplies in our country, where we do very important work there. Then we last with that ministry. We also have the Public Health Council that also regularizes our students and also registers our students upon graduation and practice. Then within the NGOs, as part of also our partners, we have the World Health Organizations. We work very closely with them. They support us in a number of initiatives, including the training materials and current updates on disease management or the disease in the world, and also the support in various research operations with them. We also have the UNICEF, we also have AMLEF, you have USAID, and we also have JICA as the partners that also we work with in the non-government organizations. The collaborating universities, we collaborate closely with the Curtin University in Australia. We also collaborate very closely with the University of Wales, Cardiff, in the United Kingdom. These people, we have worked with them in enriching our curriculum in this college, and it has really helped our students. Some of our students have also gone there to study after studying in KMTC, and that it has been very successful. We also partner with the International Federation of Environmental Health. This is an international forum for public health officers in the world. We also have the African Academy of Environmental Health. We also partner with them. African Academy are the ones who are like the custodians of the pillars of public health in Africa, and therefore we partner with them. And some of us are members of that organization, and it's key to us in our country. So I'm happy to welcome you as our prospective students in this college, and be assured that you'll get the best quality training in Kenya as far as public health training is concerned. As I said, this is a pioneer college, and I have also said that I'm a testimony of what KMTC can do in this country. And having developed from here and being here still means that you can actually trust us to offer the best training for you now and in the future. Hopefully you also come and join. So I'm happy to welcome you, our students, to join us in this course. And as I said earlier, we will give you the best quality training, the best training that you can ever get in public health in our country. As I said, this was a pioneer institution for public health in Kenya. For all the universities and colleges offering this program, they all benchmarked with the KMTC, and I'm happy to say that. So you will get the best training. So welcome, and we will support you from whichever level as you join us. The progression will be here for you. Thank you very, very much.